Hi, my name is Chloe Wohlers, and I'm currently a sports medicine 3 student here at South Tall High School. For my medical journal research, I decided to look and research more about eating disorders. Before the presentation starts, I just wanted to say that some of the information that will be talked about today may be sensitive to some viewers. So, prior to me presenting my research, I wanted to go over what an eating disorder is. So, an eating disorder is an illness where the person experiences severe disturbances in their eating behaviors and related thoughts and emotions. People who develop an ED usually become preoccupied with the food they're consuming, the calories, and their body weight. So, there are many different types of EDs that are found all over the globe, but today I'll be talking about the top 5. Anorexia nervosa is the most common ED. It is generally developed during adolescence and tends to affect more women over men. People with this ED usually view themselves as overweight compared to their actual size. They tend to constantly monitor their weight, avoid eating certain type of foods, and severely restrict their calories. So, some symptoms include having a very restricted eating pattern, an intense fear of gaining weight or persistent behaviors to avoid gaining weight, a heavy influence of body weight or perceived body shape on self esteem, a distorted body image, and calorie counting. Bulimia nervosa is another ED that is commonly developed during adolescence and is more common in women. People with this ED usually find themselves eating large amounts of food in a specific period of time where they become painfully full. Usually, the person feels that they cannot stop eating or control how much they are eating. Then they attempt to throw up in order to compensate for the calories consumed and relieve gut discomfort. Some symptoms of bulimia nervosa include a reoccurring phases of binge eating with a feeling of lack of control, throwing up the food you just consumed, a self-esteem that's overly influenced by body shape and weight, as well as a fear of gaining weight despite having a normal weight. The next disorder is pica, which involves eating things that are not considered food. Individuals who suffer with this disorder usually crave non-food substances such as soil, chalk, soap, paper, hair, and more. Pica can occur in adults and adolescents. However, this disease is most frequently seen in children, pregnant women, and individuals with mental disabilities. Individuals who may suffer from pica may be at an increased risk of poisoning, infections, internal injuries, and nutritional deficiencies. However, to be considered having pica, the eating of a non food substance must not be a part of someone's culture or religion. Orthorexia is when the person has an unhealthy obsession with healthy food. There is nothing wrong with eating healthy. However, those who suffer from this disorder focus extremely on clean eating, fad diets, ingredient lists, and food planning to the point where their health will begin to suffer. This can lead to malnutrition, severe weight loss, difficulty eating outside of the home, and emotional distress. Some symptoms of orthorexia include self esteem that is based on eating healthy food, increasingly critical and more rigid about eating, feeling as if certain foods are dangerous or evil, feeling guilt when unable to maintain the certain diet standard. But unlike anorexia and bulimia, individuals with orthorexia rarely focus on losing weight. The last ED I'll be talking about is rumination syndrome, which is a condition in which people repeatedly and unintentionally spit up their undigested or partially digested food from their stomach. They then rechew it and then either re-swallow it or spit it out. Since the food hasn't yet been digested, it reportedly tastes normal and isn't acidic like vomit. Some symptoms of this ED include effortless purging, usually within 10 minutes from eating, abdominal pain or pressure, a feeling of fullness, bad breath, nausea, and unintentional weight loss. Next, I will be talking about the risks all these EDs have in common during or after their recovery. There are many risks men and women may face during or after an ED. Physically, they can suffer from cardiovascular complications, bone and muscle loss, which can increase your risk of injury, and gastrointestinal distress. Mentally, this can cause anxiety, depression, body dysmorphia, and high risk of suicidal thoughts. Socially, this can negatively impact bonds and relationships and can negatively impact your success ability to maintain a job. For women in specific, physically, this can also affect your menstruation cycle, difficulties in conceiving a child, and infertility. On to my next subject, I will be talking about the athletes who are at the highest risk of developing an ED during their career in their sport, as well as the effects it has on them. Athletes that play the following sports are at the highest risk of developing an ED during their career. These sports include ballet or other types of dance, figure skating, gymnastics, running, swimming, rowing, horse racing, and wrestling. The reasoning behind why these athletes are at the highest risk of developing an ED during their career are because the athletes tend to be highly competitive and are disciplined individuals who will go great lengths to excel in their sport. With their personality type combined with the expectation of their teammates or coaches, put them at a high risk of developing an ED over the average person. Furthermore, wrestlers are required to maintain a certain body weight throughout their entire season so they can play against their opponents fairly. This puts the wrestler at a high risk of developing an ED because of the extreme dieting and fasting they have to do. One of the biggest threats of an athlete developing an ED is the extreme stress they are putting on their bodies. The practice of self-starvation, purging, or obsessive exercise has a detrimental effect on their performance. This process of purging and binging can result in the loss of potassium and fluid levels, as well as causing extreme weakness in their muscles and creating a dangerous and sometimes lethal heart rhythm. If you or a loved one may be experiencing the signs of an ED, there is a number on the screen as well as a website so you can access treatment, support, and other information. These are the medical journals and sources that I used throughout this presentation. If you have any questions, feel free to ask them now.